my name is Andrea Harper, and I'm going to be presenting my PowerPoint presentation that explains my practicum paper, and I will prompt throughout my presentation so that you can follow along with the slides. So I want to start off by saying thank you for taking the time to listen to my presentation today. My presentation represents my practicum paper titled Empowering Community Health Workers in Guatemala. I had the amazing opportunity to go on a week-long trip alongside 3 other public health graduate students and 2 faculty members from Liberty University. We all came from pretty different backgrounds, and we all had different things to bring to the table, which ultimately helped us reach our goal. Our main goal of the trip was to carry on work that had already begun back in 2018, health screenings in communities and teaching of health workers, community health workers, in an effort to continue the work during the year until another team is able to return. And the picture that you see in this background is actually a picture of one of the first communities that we did the health screenings in. So we'll move on to slide number 2, practicum purpose. The purpose of this practicum was to study the effects of the promotion and empowering of community health workers, also known as CHWs, in 3 different communities in the district of Zacapa, Guatemala. A shortage of skilled healthcare workers is evident worldwide, but especially in low and middle income countries like Guatemala. This has shed light on the importance of training community health workers in the communities to carry out health prevention and promotion activities that may otherwise not get done. The definition of a community health worker are members of the community who are not trained health professionals that are chosen and trained to work in their own communities. The only requirements needed to be a CHW is a willingness to learn and a dedication to their community. Aside from that, a community health worker can be any gender, age, ethnicity, and even of any educational level. Nutritional assessments in relation to chronic illnesses was also evaluated of the participants, and recommendations were given in Spanish. And the picture that you see above is actually the team from Liberty and the community health workers that we worked alongside and trained that week. Moving on to slide number 3, preparation. Preparation for this trip included a series of meetings with fellow team members and putting together materials that would be brought on the trip to be used as a guide as well as educational materials. We also got together and discussed the biggest needs that would be needed for the week, such as medications, any supplies that we could get donated from local churches or family members or friends, and also included a questionnaire that we would review with the participants at the beginning of the assessment, reference values for the measurements that would be taken during the health screening, such as blood pressure, hemoglobin, and blood sugar, and a brochure that was given to the CHWs that reviewed how to perform the health screenings that we were doing. These materials were translated from English to Spanish prior to departing on the trip. And the picture above is 2 of the graduate students and 1 of the CHWs working with 2 participants to get their blood drawn for a hemoglobin and blood sugar check. Slide number 4, design. To begin the health screenings, a mini clinic was set up in the local church with the assistance of the community health workers. Several medications were donated by the government to be distributed by our screenings to the participants in need. The participants would first get registered with a CHW who would go over the questionnaire with them in detail. Then they would go have their measurements taken, and lastly see the provider who would give them an evaluation based on stated symptoms and measurements taken. After the health screenings were complete, the CHWs were all gathered and provided an educational session which followed the brochure that we had made. Above, in the first picture, you can see the community health workers gathered for the educational session, and then the second picture shows tables with medications that were laid out to be given to the participants who needed them. And these medications included anything from Tylenol, ibuprofen, aspirin, Alka-Seltzer, things like that, and even gastrointestinal medications, deworming medications, multivitamins, and anything that was brought from the team and donated from the government. Slide number 5, accomplishments. The above graph shows the percentage of return demonstration compliance once the educational session was complete. As you can see, almost half of the group was able to give a correct return demonstration on their first try, which was awesome, and the other half were able to give a correct return demonstration after a second and third try. Aside from a successful CHW educational session, many medications were given to the participants, like I named in the previous slide. Some of these participants have no ability to get these medications at all, whether that be because they can't afford it, because they can't make it to a drugstore, any reason like that. Some of these participants were also given a medical evaluation for the first time in over a year. Many of them said that the last full medical evaluation that they had received was when the previous group had been there in 2019. So that just kind of gives you an idea of how many medical evaluations and checks many of these participants were receiving. With the help of the CHWs and the education that was provided, the expectation is that these participants will have access to more readily available health promotion checks, with more health screenings and wellness checks that would be carried on through the CHWs. In the second picture, you can actually see me working with CHWs performing a return demonstration of a blood pressure check. And we'll move on to the next slide, recommendations. Recommendations for future groups that travel to Guatemala to continue CHW education and training is to bring along medications for deworming, acid reflux, and iron tablets. During the medical evaluation portion of the health screenings, it was discovered that many of the participants needed deworming medication due to intake of unclean water, and also complained of having acid reflux-like symptoms, as well as low hemoglobin readings. Unfortunately, there just wasn't enough of these medications that had been donated by the government or brought by the team members to give out to the amount of participants that needed it. Seeing as this was a pretty common finding among the participants, I would recommend future groups focusing on these medications and bringing these medications along with them to distribute, since there is a great need there. Another recommendation would be to continue to carry out the education that was performed to the CHWs, to reiterate and reinforce that teaching to them in the upcoming years. We had really great feedback from them, saying that the information we provided was beneficial and helpful to them for the future. And my last slide is the reference used for my PowerPoint presentation. I hope that you enjoyed it, and I thank you again for listening.